if you are a nurse, either student or practitioner in the year 2021, there's a high chance that you will be floating to critical care. So let's get ready for when that time comes. Hi there, I hope you're doing well. I hope you're taking care of yourself, and I hope that things are going well for you. Welcome to Elevate Nursing. My name is Nurse Kate, and today we're talking about floating to other units during the time of a pandemic, particularly because that's one of the things that has been happening quite a bit. If you're new to the term, floating basically means being transferred from one unit to the other for several reasons. One could be there is a shortage of nurses in this unit. It could be that they have an influx in the number of patients coming in, and it could be that for any other reason. Yeah, but it's mostly related to workloads, and this has become quite common from the year 2019 to 2021, particularly nurses who are coming in from other units to critical care due to the shortages in these areas at this time, and to help really with the patient care when there is a pandemic or there is an influx in the number of patients coming in. So there are certain things that we ought to know or be aware of as we go into critical care during this time, because as we transition in, they usually with floating, you don't have a period to prepare yourself to go in, and you might have several hours. You might be informed to go in while you have clocked in already, and you might be informed to go in for the week, for the day, for the month, for like 3 months or 6 months. So there are certain things that we ought to be aware of, and that is going to help with the transitioning going in, and it can help a great deal with taking care of patients who we might not be quite familiar with in terms of patients' conditions that we're not familiar with. So one of the first things to do is to prepare yourself psychologically. Know that as a nurse during your training, you have, for them to call you to go to float to this unit, it means that you have particular skills that drive them, that you have shown particular skills that one is confident that, yeah, for sure, this nurse can take care of patients in this unit. The second thing is, as you prepare yourself psychologically, don't feel alone. Be aware that there are other nurses who are there, and they're going to help you out in the process. And not only nurses, there are other healthcare professionals. One of the best things I like about critical care is the cooperation and minding colleagues, and being aware that patients are constantly changing. The conditions of patients are continuous. The conditions of patients rather are continually changing. So as we are aware of that in critical care, we often look out for other nurses and say, yeah, you could go on a break, I'll check on the patient for you. And if you request this from time to time, I'm sure that there is a nurse who can say, yeah, I'll check the patient for you. You can take a break and go and have a drink of water, rehydrate, and so on. So sometimes with critical care, even as I was getting into critical care at a very young professional age, I was very anxious about that. I was quite anxious about the changing conditions of patients, and I felt like, oh my goodness, I'm not very sure if I can make it. But other nurses were very helpful at the time, and it gives you confidence as you go on. So as you get into it, don't be worried about it that much. So something else that you can do to be prepared and to improve your confidence as you go into critical care is, one, be conversant with the protocol in these units. So you can read up on the protocol in critical care in terms of ICU, HDU, NBU, accident and emergency, or whichever area, or the CCU, whichever area of critical care that you're getting into, or that you have in your unit, in your hospital rather. If you can brush through the protocol in these units, you'll be better prepared when you go there to understand how the system really works, and where do they put the equipment, where do they put this and the other, which patients go in which direction, and what do you do when the patient condition changes. Are you going to transfer this patient to another area within the critical care unit, or what happens in that case? So that's really important to know. Something else that you think about when you're reading the protocol is to say, which specialties do we have? Which other subspecialties do we have in critical care? So if within these subspecialties, you'll say in ICU, if you have a multidisciplinary ICU, what are the types of patients that come to multidisciplinary ICU? Are they surgical, medical, surgical? Do we have both medical, surgical cases? Are we going to be dealing with neuro cases and so on? So as you go through this, you are better, you start reminding yourself of the possible cases or conditions that you might experience, that you might have the opportunity to take care of, and you can brush up on this as you go on. So that's the first thing to do, yeah, apart from being prepared psychologically. Something else to do is brush up on ACLS and BLS. Now, basic life support and advanced cardiac life support are some of the skills that you ought to have in terms of how to manage an emergency, and these you can find in different books that are reviewed on an annual basis. So you can go online and you can find some of these books, or if any of your colleagues have them, you can go through these. And if you have time to get certification on that, it's a plus. It's an absolute plus for you. It's an absolute plus for your colleagues, for your patients. It's an absolute plus. But if you're not able to get certification for that as quickly as you need to, you can read through the books and the manuals on these courses. Something else to do is take a look at the emergency medication and the emergency trolley. So in the emergency trolley, we have specific types of drugs that we use during emergencies, and from that you can pick out and understand the mode of action of each drug, as well look at the dosages that are provided. So with that, you're better skilled whenever there is an emergency. You will understand which drug is to be given at this point. If you're asked for a specific drug, you know where it is and you know the mode of action. So that's really important. As we talk about drugs and the emergency drugs as well, something else that is really important to keep in mind is you can brush up on drug calculations. Some of the most important drugs to remember as you go into critical care are inotropes. Inotropes are drugs that affect the pumping function of the heart in simple terms, and these are drugs that are most of the time used in cardiac ICU. You can also look at drugs, sedative drugs. Look at the calculations for these drugs. Be aware which drugs are often used, the kind of inotropes that are used, what are the dosages that are available, and what are the formulas to use when you're calculating these drugs. Is it dependent on micrograms, milligrams? Is it international units that they're using, if it is insulin, and so on. So those are the things to remember. There are different machines that are used to infuse this medication, so you can look at how do different machines work. And as you look at the protocol as well, just be aware that which machine are they using for infusions. So as you look at the machine that the unit uses for infusions, then you can understand, oh, how does this machine work, because they work differently. So those are some of the things to remember. Something else that is really important as you go into critical care, as it is important in nursing generally, is remind yourself of head-to-toe patient assessment. But the assessment in critical care is quite different, especially in ICU. It is different. The head-to-toe assessment often involves, you ought to be aware of the instrument that is being used, in terms of, think about the invasive instruments that are used. So if you are thinking about reviewing a patient head to toe, are they using a nasogastric tube? So what's the size of this nasogastric tube? How many days has it been in if the patient is intubated? So all those are the things to remember as you do the head to toe assessment. This is something that is done on a daily basis during every shift. So as you go into it, you need to know your patient. So that's how you learn how to know your patient more, is to do a head-to-toe assessment. So you can refresh on that and read on it and ask colleagues, or you can read on it. There is a segment of head-to-toe assessment that we have done, and I will leave a link to each and every item of this in the description box, and you can click on it and you can learn more about head-to-toe assessment in critical care. So the last thing to remember as you go into critical care and you prepare for it is that the patient conditions are constantly changing, and they can be quite rapid. So as you go into it, be aware of that, be as attentive as possible, take notes as much as you can. Take notes, and that will be your pocket brain, that you can remember everything. And remember as well that as the patient conditions changes, the priorities are constantly changing. So as you're aware of your patient and assessing them constantly and being aware, looking at the numbers, you will be able to predict when these conditions might change, and you'll be better prepared for that. All in all, I wish you all the best as you prepare for floating to other units. And remember, that floating is not only to critical care or ICU. You can float as a nurse from critical care to the general floor, where patients are more stable compared to critical care. So there are different dynamics to this, but all in all, be aware of what happens in different units, what are the kind of patients that go there. But to critical care, the most important things to remember is that the patient's conditions are gradually changing, so you ought to be prepared for that. How are you prepared for that? By knowing building your confidence internally, and knowing that you can always ask when you're not sure. The other thing is the specific things to learn about the changing patient's conditions include ACLS and BLS, the emergency drugs that are in there that are being used in critical care. Something else to remember is how to calculate drug dosages in terms of the inotropes that are used, in terms of infusion pumps, how do these infusion pumps work, and so on. So one last thing to remember, and this is on a very personal note, is that when I was getting into critical care, I used to feel as though it's a high energy environment and you need to do things quite fast. As much as you need to do things, you need to move quite swiftly in the ICU. Be oriented in terms of this is in this direction, this is there, these items are here, the other items are there. So whenever you need to move about during an emergency, you're not going to be confused. Remember to hydrate as much as you can, and do not skip your meals. If you need to ask somebody, is it your partner that you paired for the patient, to say, I would like to go on my lunch break now, hydrate, use the bathroom and eat, and that way you'll be energized throughout the day. All in all, thank you for being a part of this. If you have found this video useful, you can subscribe to our YouTube channel and follow us on social media. We are at Elevate Nursing on Facebook, Instagram and Twitter. All in all, have a lovely day, and until next time, Elevate Nursing. Cheers. Bye.